Hi, I'm Cynthia Koons, healthcare reporter at Bloomberg News. I'm joined today by Oren Frank, the founder of Talkspace, and Seaju Jeong, the founder of Noom. These are two cutting-edge mental health and wellness telehealth companies, and we're here to talk about mental health in the pandemic, which I have to imagine has been on everyone's mind. It's certainly part of almost every conversation I have these days, especially as we round the year mark. And I wanted to start out with a poll we did. We actually asked our viewers how they've been faring through the pandemic. So the question was, what has affected your mental health the most during the pandemic? And they talked about four different things. And the largest one, 40%, said social isolation. And I believe we had one other question about how challenging the pandemic has been for your mental health. And our viewers actually said, I think it was about half of our viewers said they've been doing okay. And about 49% or 47% of our viewers actually said it's been worse than they expected, or it's been pretty hard on them. And so I wanted to start there. How has the pandemic been for you guys? Oren, if you want to talk a little bit about it, what has been your key learning in terms of supporting your own workforce and coping through this really challenging time?
Yeah, thanks for inviting me, Cynthia. It's great to be here. And I think the numbers that you quote are absolutely spot on. We see similar data in which about half the population shows signs of suffering mentally, behaviorally from this pandemic. And so the number of people suffering is dramatically higher, and also the severity or the acuity of their condition is significantly higher as well. I would actually address this as a second pandemic, which probably and unfortunately will remain with us after COVID is gone, hopefully very, very soon, and will need a lot of attention, focus, and dedication. That is from our patients, our members that actually use Talkspace to work with a psychotherapist or a psychiatrist on their conditions. But of course, that applies to our employees, our teams, our members just as well. We are all isolated for just over a year. We're all dealing with the social isolation. I would add relationship issues, which are being surfaced dramatically by many people. And it is I'll say it, in a different way. We have doubled our company over the last few months, and it's very unfortunate that this is actually an outcome of COVID. But I think COVID just dramatized and exposed the gap, the huge gap between the available mental health services in the United States and between the need. That gap existed prior to COVID, but post-COVID, it's something that we cannot ignore anymore.
Now, Seiju, you're in the wellness and mental health space. You're moving into anxiety and cognitive behavioral techniques for people who want to help manage their own anxiety at home. Can you talk a little bit about your journey starting in weight management and moving into potentially into this space with anxiety being a focus now too?
Absolutely. I also want to mention that it's my honor to be invited and speak with my respected the business partner, Oren, here. And I want to echo what he said as well, because we, good to see you, Oren. Although we are socially isolating, we can see you over Zoom. So it's nice to see you, Oren, and thanks for having me again. So Noom story, thanks for asking, Cynthia. Noom is consumer-led health, digital healthcare platform. And you may wonder why weight loss. We figure weight management is the best way to manage your overall health because weight is the right barometer for making sure that our users are doing well in terms of the health. When we mention health, is your mind, your body, your relationship. It has to be a holistic approach. That's the way Noom has been focused on end user experience. And as Oren really well said, that prior COVID-19 time, we discovered very interesting stats that we asked our Noom users, what else would you like to learn more than weight loss? And 2/3 of our users said they want to learn. Our users said we want to learn about how to cope with stress and manage anxiety. And we were very surprised. And unfortunately, COVID-19 cannot form the healthy habit, which that's the way we build the service that we want to help our end users build healthy habits. That's the way they can manage their weight better. And anxiety, stress is one of the main blocker. And we paid attention how we can unlock that. And COVID-19 came, and surely that it became another the blocker. People could not develop and manage the overall lifestyle. And we have seen a lot of demand from the market. And another matter that I want to mention that COVID-19 time also helped us to understand overall health. And we also, it was the opportunity that we learn the overall healthy lifestyle does not start from the doctor's office. It starts from home. And there are many people are trying to learn how to get healthy and also maintain and build a healthy habit. I think that's a remarkable change and silver lining out of COVID-19. And I believe as soon as we can come back to normal, I believe there are many people who continue to seek for how to get healthy, to live a healthier lifestyle.
So when we talk about your platforms, I think it would be helpful for our viewers to understand how they can access them. So of course, there's the model for the paying subscriber, but can you guys talk about the growth avenues you're seeking that may reach into people's, say, health plans or working with governments directly to reach people? So Oren, if you want to talk a little bit, particularly on the government side, about how you can get even wider adoption so people who might not be able to afford the subscription fee can still get the help they need. It'd be really interesting to hear how you guys have rolled that out.
Absolutely. So essentially what we do is we provide psychotherapy and psychiatry, so mental health services by licensed professionals, and across any channel or avenue that they want. So we do it direct to consumer. People pay out of pocket. We work with large plans, insurance companies. We work directly with employers. And of course, we work with, I would say, municipalities, government organs, et cetera, because what we really want to generate is a sense of ubiquity, which is no matter where you are and who you are and what's your stage in life, where you work, who you work for, you should have access to professional behavioral health. It is, in our opinion, a right. It's something that's needed for everyone, and it's something that needs to be available now, as in on demand or nearly on demand, and in a high quality and in a high affordability. That's our mission, that's our vision. So whoever wants to, I would say, help us distribute that and achieve that kind of ubiquity, we will work with. We have municipalities. I'll give you one example. The city of Reno, 200,000 residents have access to Talkspace completely free, subsidized by the city. I think this is, and there are other, thank you, Seiju, that's very kind of you. I think this is a great example for, I would say, organizations that are civic organization, government organization, to lead the way and say access and quality before any other consideration because of this situation that we're facing today.
And Seiju, for your model, I think you've been in this individuals pay for your service and are starting to move into the potential to join, say, company plans. Can you talk a little bit about what the expansion might be like for Noom going forward, how people might get access to it in unconventional ways?
Absolutely. We've been growing healthy well last 5 years from a B2C market, pay out of their own pocket, that people are purchasing a product, and we are very thankful where we are today. And there are a lot of demand from the payer, employee market, and also a lot of doctors are recommending our service. I'm extremely thankful for that. So there is an organic conversation that employer and also payers are inviting our platform to their as a part of the service. That way they can provide a preventative service. And also last year, I want to share some stats that last year, the American adults, 72% of overall Americans are either obese or overweight, and that number has been again increased over COVID-19 time. So it does impact overall chronic condition risk and also the overexposure to chronic condition if they are not exposed. So we believe the pre-diabetic conditions patients and also the diabetes patient, they need to pay attention to how to tackle these issues. And we believe the weight management is the best way. So the government is actually making some effort to reimburse the DPP service, diabetes prevention service, in order to they provide the preventive service that can manage and prevent the diabetic conditions. And I believe this virtual DPP reimbursement act is should happen soon, and we have a lot of hope. And not only Noom, a lot of digital healthcare companies are wishing to happen over this new presidency.
And just quickly, yeah.
I would add to what Seaju said. I think what Noom is doing is brilliant, not short of brilliant. And once he starts working with companies directly, Talkspace would like to be the first one to offer it to our employees because I think it's really, really needed. I think many such companies are needed. Those are complementary services that help people get better and I would say more wholesome and holistic, I would care for their minds, their bodies, the soul, and everything. So once we add all of this, we're going to get some good healthcare outcomes.
And just for our viewers, when you say payers, just so people understand, you mean integrated into insurance plans. So I might go on my insurance plan and using Noom might be covered by insurance as you roll these programs out, correct?
Correct. There is active conversation, and I believe the time has come. Over COVID-19-led digitalization is happening, and people and users expecting to get more service for preventative service, and Noom is right there.
Now, this is a competitive space, and there are other companies moving in and trying to replicate some of the work that you guys are doing. And so, Oren, if you want to start with just talking a little bit about how you stay ahead of the competition, given it is a model that an app developer could try to replicate, what keeps Talkspace at the vanguard here? How do you stay ahead of that competition?
Yeah, absolutely. First of all, competition is good, actually. It keeps you on your toes. And secondly, let's not forget that this is an immense and underserved market. And this is not going to be a case where one company is going to solve the whole thing. I think the world needs a lot of help. Having said all that, we've been at it for 10 years. We're essentially a technology company. The vast majority of our employees are software engineers. And I think what we have done is come up with a completely new metaphor on how to manage the quality and the distribution of mental health care, which is completely discontinuous with how this industry was handled in the last 50 years. And unfortunately, it's changed very little in the last 50 years. So even when you look at competitors, and they are, as you said, you're absolutely right, they are rising left and right. First of all, I welcome this. I think it's good. And second, I sleep pretty well at night knowing that we've been going through what they have been trying to do for the last decade. And at the end of the day, what we really want to measure is the clinical impact on the lives of our members and patients. This is the holy grail, the holy goal, and this is where Talkspace excels. And I believe we will keep that advantage.
What a noble comment. What a noble comment by the Oren. I did not know how the way you measure your success, and it's very respectful. And we actually have a similar metric at our company that the way we measure our success is how many quality lives, that life days we increase by providing new service is the way we measure our performance. So Cynthia, I feel the same. Last year, when I read the stats that 72% of adults in Americans are either obese and overweight, that number has increased. I had a little hard time to understand that, to be honest. So I think there's a lot of, including Noom and we Talkspace, we all try, and I think we have a good opportunity. We can finally shift the focus from sick care focus to preventative care, and a holistic approach should be the primary the use of our effort in healthcare overall. But I understand your question. If I may brag about Noom, we from day first we pay attention to our end users. That's why we start from B2C to make sure that we can monitor and learn, so we can improve our service quality all the time. So I think that's our moat, because we have millions paid users, and that's the largest scale. So we became the largest consumer healthcare company, and I'm very proud of that. And second, we have a lot of good, very good, passionate and good heart people. The coach are full-timers. We have more than 3,000 full-time human coaches in the United States, and they're very nice people. And we help them to empower their service to end users through mobile platform. That's our secret sauce, and we learn from end users. We learn from passionate human coach, and we'll continue to develop better service.
Now, the other competing factor here is going to be time. As the world starts to reopen, I think we're all hoping that within, perhaps hopefully soon, but this year, this summer, we will start going back to life as usual. We will be commuting to work. We will be very busy again. We will have social lives if we're lucky. And when that happens, what happens in terms of your ability to grow? So I'm curious how you view that kind of next stage. You've obviously had a year where people have been home, maybe prioritizing health and mental health in a way they hadn't before. Do you want to talk a little bit about how you're positioning for that hopefully upcoming reality? Oren, if you want to start.
Thank you. So I think, COVID, in our point of view, and we see it in the numbers as well, was just an acceleration of something that has happened before COVID and will continue post-COVID, which I really hope you're right, and is just around the corner. And I think if you look at behavioral healthcare, it is a particularly good fit for virtual care. There are no blood tests, there are no x-rays. No one has to touch anyone for diagnosis or a prognosis. It is essentially a conversation, an exchange of compassion and of experience and of intelligence and of empathy. And that can happen remotely extremely effectively. Of course, not 100% of the cases. There are some cases that needs face-to-face care, but I would estimate that around 80% of all the interactions within behavioral healthcare will eventually happen remotely. The entire healthcare industry is moving to remote care because it opens up access and generates better efficiencies in quality of care. But the front end of this and the most befitting set of healthcare solutions is in behavioral. If you look at the utilization numbers of virtual care through COVID, you will see that in the beginning, everything rose up. Acute care, everyone called their doctors remotely, and it actually came back pretty significantly in terms of acute care. The only place where it's still growing more and more, unfortunately, as I said before, is in behavioral health. So we don't foresee any change. We think the market has matured. The bridge has been crossed. Whatever metaphor we choose here, we think this is the state of things to come in the future as well.
And we have one last quick question. Sorry, I'll ask this of you, Seaju, and Oren, if you want to add in. Just one last quick question. It's an audience question. It's a very good question. Given that minorities are still only comprise a small fraction of mental health professionals, and also that demand is obviously for your services, there's demand from all kinds of diverse backgrounds, how do Talkspace and Noom cater your services to make sure you're reaching minority communities?
I'd like to quickly comment on that, by the way, including the previous question. So I predict during the COVID-19 time, we learned the value of the life, and a lot of people pay attention, family value and overall health. So I think that's the silver lining. So I do believe after post-COVID-19 time, people will continue to seek for how to live the healthy lifestyle. And I believe that's a new luxury from all the generation. That having a healthy lifestyle is now a new luxury than before maybe material matters as a luxury, but I don't think that will continue. I think the people will seek how to get healthy lifestyle. And to comment on how Noom Noom wanting to react on a minority support for our service, that is one of the reasons that we found the company, because we felt like, why healthcare is so expensive, why it's so important that we don't have so much control, and also it's too expensive. So we want to build a affordable service and applying technology, and that's what we are doing. And second, we also understand there are the users may need a little more help. So we want to provide a service. We've been doing that actually. It's called New Mom Project. So we provide a service for the mother who need a little more support, and then we are very happy to provide service. That way we can help more lives, and we'll continue to do that. We have a series of the project is lined up, and I'm very excited, and then we'll continue support to provide new service to help more lives.
I think this is a very, very spot on question. The data is correct. About 85% of providers are actually white women. We've been busy, out of our 3,000 strong provider network, we're actually at about a third of minority providers. So we are compensating heavily to this very good question, but there's still a lot of work to be done, which is far earlier in when people choose their career path and go and study behavioral health professions. This is where we need to make impact, and we'll talk about it in some other time, I guess.
Well, thank you both for taking time to talk to us today. I think we're all very excited to see what's to come from your companies, and we really appreciate you joining us. So thank you.